but for OPRA exam, it consists of only one paper with 2.5 hours duration. So they have completely changing, and this change is applicable from March 2025. So, and further updates, I will keep on giving the further updates, like what other changes that have been done, like they have also reduced the fees, examination fees, and I will give further updates regarding this exam. Hi guys, another update regarding OPRA exam for Australian Pharmacist, Overseas Pharmacist exam. So the exam methodology and the pattern, it will be similar to that of CAOP, and it will also be similar to that of the intern pharmacist written examination. So CAOP is the exam that will be conducted for the pharmacists who are already practicing in US, UK, Canada, and if they want to migrate to Australia. So for them, the exam will be the CAOP, and in this exam, like they mainly ask more about the clinical therapeutics. Okay, so even in the OPRA exam, now they are going to include more towards the therapeutics, and they are reducing the the basic pharmaceutical sciences subjects. Okay. So I will give more updates regarding this exam, the complete pattern of this exam. Okay, soon I will make a full-length video, and stay tuned with Elite Expertise. Thank you. Hi guys, it's an urgent update for all the KAPS aspirants. Starting from March 2025, Australian Pharmacy Council is no more conducting the KAPS exam. So the last final KAPS exam will be held in November. The coming November will be the last KAPS exam, and from 2025 March, they are going to change to a new pattern of the exam, which is known as OPRA. That is Overseas Pharmacist Readiness Assessment. So the pattern is completely changing. For KAPS, there will be two papers, but for OPRA exam, it consists of only one paper with 2.5 hours duration. So they have completely changing, and this change is applicable from March 2025. So, and further updates, I will keep on giving the further updates, like what other changes that have been done, like they have also reduced the fees, examination fees, and I will give further updates regarding this exam. Hi guys, another update regarding OPRA exam for Australian Pharmacist, Overseas Pharmacist exam. So the exam methodology and the pattern, it will be similar to that of CAOP, and it will also be similar to that of the intern pharmacist written examination. So CAOP is the exam that will be conducted for the pharmacists who are already practicing in US, UK, Canada, and if they want to migrate to Australia. So for them, the exam will be the CAOP, and in this exam, like they mainly ask more about the clinical therapeutics. Okay, so even in the OPRA exam, now they are going to include more towards the therapeutics, and they are reducing the the basic pharmaceutical sciences subjects. Okay, so I will give more updates regarding.
A warm welcome to the pharmacist present over here. I'm Ashrita, Admin Manager of Elite Expertise. We have more than 80 number of viewers on our YouTube channel, which is named under Elite Expertise. To just give a brief in a nutshell, Elite Expertise is an online education platform which is founded by Mr. Arif, Mohammed and Harika Bimwarpu ma'am, which we cordially call them as Sir and ma'am. Arif Sir and Harika ma'am are the directors of Elite Expertise. They have founded Elite Expertise in a notation to help the pharmacy students to keep their mark in overseas by qualifying KAPS exam, PEBC exam, and intern oral written exam. I'm very much excited and happy to share that in the recent KAPS July 2024 result, we have got 96% of pass percentage. We are the only one institution in this whole world who is having the highest pass percentage, and our students are very much happy, and our directors are also happy. But viewers don't get into notation that why did Elite Expertise come on a live today just to share the success stories? No, absolutely no. Morning 4 o'clock, we received a news from APC stating that a very big breaking news is KAPS is replaced by OPRA. So what is OPRA? Why is KAPS replaced? What are the main components in OPRA? What a student has to do? What is an eligibility criteria? If I have to do, why I have to settle in Australia, why I have to write OPRA, when is CAPS exam valid, and why it is valid, and how many days it's there. Whether skill assessment is same, or if you come to New Zealand, CAPS exam is valid for New Zealand as well, right? Whether OPRA is valid for New Zealand. To answer all these million-dollar questions, we have our respected Arif sir to answer all these questions. Guys, sir will be coming within few minutes of time. And let me introduce all our team members, Elite Expertise. I can say army, family of Elite Expertise. I'll go with Neha. Neha, maybe you can show your amazing happy face. So to the subscribers or to the viewers of Elite Expertise page, this is Neha. She's CAPS qualified, CAPS qualified students. She has qualified CAPS in 30 days. She is working as admin manager of Elite Expertise. Hi Neha, how was your day?
Hello, ma'am. As we woke up with a sensational news, the
Yeah,
day was a bit
I
confusing and exciting as well.
yes, we have we see Neha, we have got n number of questions on YouTube, Facebook,
Yeah,
LinkedIn, whatnot, you name it, we have got everything. So
yes.
maybe we can give so much. There is so much of insights waiting for Arif sir. We have a wonderful, I guess, release there, right? Really, all the Malayalam audience want to see really. There is really. Hi, really. How are you?
I
She's an
am
Ab-
good.
Yeah, she's November CAPS qualified student as well of Elite Expertise. She's working as an other admin manager. Like Neha is head admin manager for India and release and admin manager for UAE, other Gulf countries, exclusive for the Kerala and all. So how was your day, Neha? Really?
Yeah, we're waking up with a very shocking news, and
I know. It's
yeah,
like,
from that moment, we are receiving a number of calls and messages
yes,
asking for so many questions regarding CAPS,
yes,
OPRA exams.
yeah.
So I think today we will sort it out everything, all the
Maybe
questions.
you can, yeah, sorry to cut you out. I always do that. Maybe you can say a word in Malayalam so that all your Kerala people will be feeling oh happy and all overwhelming.
Yes, definitely. So ആരും പേടിക്കണ്ട, ഹാരിഫ് സാർ എന്തായാലും നമ്മുടെ ക്വസ്റ്റ്യൻസ് ഒക്കെ ക്ലിയർ ചെയ്യുന്നതായിരിക്കും.
I did not understand anything, but it's okay.
It's hard
Yeah,
than OPRA examination.
yeah.
Oh, okay.
I was just telling nobody has to be scared. All the questions will be cleared by Harif sir.
Good job. Good job. Next, we have Glory. Glory is another admin manager. She's Glory. Maybe you can unmute yourself, open your video and all so that everyone can see you, dear. Are you there, Glory? Maybe she's working on some other thing else. That's fine. We can see her as well. Sahana. Hi, Sahana. Maybe you can show your the main thing behind all the content writing which is being done on Elite Expertise, website, LinkedIn, everything. Hey, Sahana, how was your day? She's the head of content writing and everything. How was your day, Sahana?
Hi, Ashita. It is great seeing you. But today was a hectic day for all of us. Collecting all the data that is required for all our students and everybody in
Yes.
this webinar, so that it is
Yeah.
helpful for everyone. And we are the first
Yes.
ones to give this information out
Yeah.
when compared to the
Yeah.
other coaching centers too. So
Yes.
Arif is going to answer all our
Yeah.
questions and queries. So yeah.
Yes. Yeah. Hoping like I guess we'll have a very long session. And we have Sri Subatsan. Thank you. Thank you. So sorry, I forgot to thank you. Thank you, Sahada. We have Sri Subatsan from Sri Lanka. He's the main backbone of Elite Expertise, the head of digital marketing, multimedia marketing, and not multimedia, social media marketing, website designer, you name it. There we have Sri Subatsan. Sri Subatsan from Sri Lanka. How was your day, Sri? I know it's been 3 days that we have slept properly, entire team. So how is your sleep? You tell me that.
We are working so hard, right? Last day, like we got the good results, like
Yes.
more than
Yes.
1 students have cleared it. And today, a new
Yeah.
big news regarding
Yeah.
the CAPS. So hectic. But
I know.
hopefully we are going. So let us
Yeah.
I will like sir will today is going to answer questions. So let's
Yes.
see how it's.
Yeah. And Shri, you're a CAPS qualified, right?
Yes, I'm also KAPS qualified. November
So if you see
2020.
in the team, yeah, in the team of Elite Expertise, everyone is a pharmacist. And if you ask from A to Z, everyone is there to answer in the field of pharmacy, not only in the field of pharmacy, but in the field of healthcare. So Elite Expertise team is designed in such a way that they are very knowledgeable and they're very friendly, and we have a human to human connection. And we have Hira, who is head of, she's a part of editing for exclusively India region, and she'll be heading for the LinkedIn. Hira, are you there, dear? No, is she not there, Neha? Should not join me. No, she's not. That's okay. Hira will also be joining. She's just a 23 years old girl who is working day and night, doing each and everything. So yeah, she's there. We have, I guess, I've just joined. I don't know. Yeah. We have Ashutosh as well. Ashutosh is a technical expert of Elite Expertise, is the head of technical expert. Ashutosh, are you there? Is it okay for you to unmute yourself or show your video? Is it okay? Maybe they are working in the back end. Yeah. So basically, they are the backend people who will be working from like day and night to solve all the queries from starting to ending. So without a further ado, we have Arif sir on board as well. Arif sir will be answering each and every question. Rakesh, we have Rakesh Khan, who is the head of brand marketing for Elite Expertise. He's a KAPS qualified. He has lost his expression of interest and he'll be soon in Australia. Hi Rakesh. आप कैसे हो?
हेलो मैम, आई एम फाइन। आप कैसे हैं? Am I
क्या आप
audible?
सेलिब्रेट कर रहे हो क्या? Are you celebrating Elite Expertise
Yes,
past
ma'am. July
percentage
is the
tax?
past percentage. Yes, ma'am. Definitely, I am enjoying
Oh, okay. Yeah, I know. I can see that visually.
yes, ma'am.
Yeah. So that's Rakesh, guys, for each and everyone. We'll have a short video of 3 videos where Arif sir has done recently in the morning. So for a few minutes, for maybe 2 or 3 minutes, the videos will be, popped up so that everyone will have a better understanding. Ashutosh, could you please start the videos, please?
Hi guys, it's an urgent update for all the KAPS aspirants. Starting from March 2025, Australian Pharmacy Council is no more conducting the KAPS exam. So the last final KAPS exam will be held in November. The coming November will be the last KAPS exam. And from 2025 March, they are going to change to a new pattern of the exam, which is known as OPRA. That is Overseas Pharmacist Readiness Assessment. So the pattern is completely changing. For KAPS, there will be 2 papers, but for OPRA exam, it consists of only 1 paper with 2.5 hours duration. So they have completely changing, and this change is applicable from March 2025. So, and further updates, I will keep on giving the further updates, like what other changes that have been done, like they have also reduced the fees, examination fees, and I will give further updates regarding this exam. Hi guys, another update regarding OPRA exam for Australian Pharmacist, Overseas Pharmacist exam. So the exam methodology and the pattern, it will be similar to that of CAOP and it will also be similar to that of the intern pharmacist written examination. So CAOP is the exam that will be conducted for the pharmacists who are already practicing in US, UK, Canada, and if they want to migrate to Australia. So for them, the exam will be the CAOP. And in this exam, like they mainly ask more about the clinical therapeutics. Okay, so even in the OPRA exam, now they are going to include more towards the therapeutics, and they are reducing the the basic pharmaceutical sciences subjects. Okay? So I will give more updates regarding this exam, the complete pattern of this exam. Okay, soon I will make a full-length video, and stay tuned with Elite Expertise. Thank you.
That was a very short video which Arif sir made, and we have Arif sir on live as well. Good afternoon, Arif sir.
Hi, Ashita.
How was,
Thank you. Yeah, I'm good. I'm good. Thank you.
how was your
And
day? And let me congratulate you for having 96% of pass percentage on KAPS exam result. We are
thank
bidding
you
in
so
the
much for
first
that.
for having the highest pass percentage. How are you feeling it now, sir? I know you're mixed up with the feelings and all.
Yeah, exactly. Like there are a few of the things which are going on. Like since morning, like I went to hospital like to my work today this morning, and the moment soon I parked my car, I started getting the messages on my WhatsApp, and then a few of the students, they were sending their things that APC has officially sent the email to them. And then I have visited the APC website. Then it was confirmed that APC is going to change the exam pattern from March 2025, and they are going to change it to a new exam which is known as OPRA, and the KAPS will be the last exam for November this year. Okay. So it was a breaking news. Then after having that news, like even when I was working in the hospital today, all the other pharmacists with me, those who are working there, we were discussing about this exam and what changes
I
are going
know.
to happen and how this exam is going to affect the candidates, especially the overseas candidates who are planning to migrate to Australia. How the exam pattern is going to affect and so on. So these are the discussions that we were that were going on the whole day. So today when I was working in the hospital. So well, like we have been receiving a lot of questions regarding this new
Yes.
OPRA, and we
Like we have
finally.
many bunch of questions, so not only from the family, like your colleagues have asked you, but
Yeah,
we have
yeah.
received like thousands of questions since morning. So we have picked the topmost questions, sir. Our like team, we have divided into certain like three, four members of elite expertise, and we
Yeah.
have made some bunch of questions. We have picked the topmost asked questions, and we have many live answer questions. So first we'll go with the topmost questions, which the students, the pharmacists, the working pharmacists who are there round the world, round the clock working. So we'll be picking those questions we'll be asking you, sir. Post that, we'll be asking the live shared questions. Is that
Yeah,
okay, sir?
sure.
Maybe the live
Yeah,
will be
yeah,
going.
I'll try to answer as much as possible. Okay. So because the
So,
exam pattern, everything is new. So
yeah.
like whatever the information that officially we got it from the APC, so we are going to present that information to our candidates.
Yeah. So just grab a bottle of water, that will be helpful for you, sir. So let's shoot up the question, guys. Ready, steady, set, go. Neha.
Yeah. Hello, sir. Let's dive into OPRA from KAPS. A complete transition we have from now on, and it will be exciting for us too to learn some certain things. And we have some questions over here, sir. And can we start with description of OPRA exam? Like what is OPRA exam and etc. Everything.
Yeah, so Australian Pharmacy Council has decided to start a new pattern of the exam. So like APC has been conducting this KAPS examination for many years. And now they have decided to make some changes in the pattern and changes in the methodology of the exam and so on. So that's why they have decided to bring a new pattern that is known as the OPRA, OPRA, which stands for the Overseas Pharmacist Readiness Assessment. Okay, readiness assessment. So it clearly indicates that the pharmacist, the overseas pharmacist, they should be ready to start their internship. Okay, so earlier the exam was knowledge assessment, the KAPS, knowledge assessment of pharmaceutical sciences, but now they have completely changed it to overseas pharmacist readiness assessment, so that they want the overseas pharmacists, they want not only to check the basic knowledge of the overseas pharmacists, but also their application capability, their comprehensive skills, and the application capability. Okay, so everything will be. They just want to make those things to be checked. So that's why they, I guess they have changed this to KAPS, from KAPS to OPRA. So OPRA stands for Overseas Pharmacist Readiness Assessment. And yeah, so this is the new thing that Australian Pharmacy Council has announced on 31st of July, that is today, this morning. So in Australia, around 6 o'clock, we started getting the news. So from 6 o'clock. So this is the new exam that APC is going to conduct.
So you mean like upgrading from knowledge to readiness?
Yeah,
The major.
I think so. Yeah. So that is upgrading from knowledge to readiness. And also, like, there are a lot of changes that officially mentioned in the APC website. So those things that we can discuss it today.
And what are the major changes we can differences from KAPS to this OPRA, sir? OPRA exam.
So I just want to share a presentation slide with you
Sure.
so that it will be clear. So this is the information again from the APC, from the official website of the APC. Okay, so I guess you can see this slide, which is up over there on the screen. Okay. So KAPS to OPRA, so what are the key changes and all the things that we need to know. So especially for the overseas candidates, so those who are planning to migrate to Australia and to become a pharmacist here in Australia. So what are the key changes that are going to occur to become to write your licensing examination? So that is KAPS is completely going to change to OPRA, OPRA. Okay. So let's have a look. Now, the important dates. So before, at first we can have a look through the important dates. So the final KAPS examination, Australian Pharmacy Council has announced that the OPRA exam, they are going to conduct the OPRA exam starting from March 2025. So from March 2025, they are going to conduct the OPRA exam. And the first exam for the OPRA exam will be held on 3rd to 5th of March in 2025. And before that, as usual, for the November examination, so they are going to conduct the same now, the KAPS exam. For the coming November, they are going to conduct the same KAPS, so without any change in the pattern and without any change in the syllabus. But from starting from March next year, 2025, they are going to change it to OPRA exam. Okay. And the OPRA exam registration dates, it starts from 9th of Jan to 3rd of Feb. Okay, so 9th of Jan to 3rd of Feb 2025, the registration for OPRA examinations will start. So before that, like here, the registration will start from 9th of Jan and it will last till 3rd of Feb. It means that before the registration it starts, the candidates, they must undergo their initial document evaluation. Okay, so the initial document evaluation should be done before this registration date it starts. Okay. Then, what are the changes that they have made for this OPRA exam? Okay, so the changes that they have made are the duration of the examination. So earlier we know that for KAPS examination, there used to be two papers, paper 1 and paper 2. Paper 1 used to be 2 hours and then paper 2 used to be 2 hours with a 1 hour break in between both the papers. So, and in KAPS examination, there used to be like total 200 MCQs, 100 MCQs in paper 1 and 100 MCQs in paper 2. Okay. So total 200 MCQs. But for the new exam pattern, that is the OPRA exam, so APC has changed it from 200 MCQs to 120 MCQs. And the time duration also has been reduced. So earlier for KAPS examination, so even now the KAPS is still going on. For KAPS examination, it is 4 hours time duration, but now they have reduced it to 2.5 hours. So in 2.5 hours, the candidates, they need to complete the 120 MCQs. So, and also the other change that APC has mentioned in the website, that they have revised the content. Okay. So the content of the examination has been revised. Okay. So what changes that they have made in the content, that I will show in the next upcoming slide. Okay. And the methodology of scoring system is also changed. So this is the most important one that I'm going to discuss. Okay. So the scoring method has been changed. Okay? And also they have reduced the examination fees to now it is $2,190. Okay, for OPRA exam, the fee is $2,190. Okay, so these are the changes that Australian Pharmacy Council has made, and they have officially posted in their website. And this is the information from the official website of APC. And then now this is the exam duration. So earlier KAPS used to be for 4 hours, and OPRA exam is for 2.5 hours. Okay? So in KAPS, there used to be 2 papers, and in OPRA, it is only 1 paper. And in KAPS examination, in each paper, there used to be 100 MCQs. Okay? But in OPRA, now the total MCQs, only 1 paper with 120 MCQs, 120 MCQs. So 120 MCQs, so we need to answer it in 2.5 hours. Okay? So 120 need to answer in 2.5 hours. Okay? So these are the changes in the examination duration, okay? And the examination pattern. Okay? So now coming to the core content, that is the syllabus. So on the left hand side, you can see the KAPS exam content. Okay? And on the right hand side, you can see the OPRA, that is the new exam content. Okay? So in the KAPS examination, we had 2 papers, paper 1 and paper 2. And paper 1, there used to be 2 main core components are the core subjects. One is the pharmaceutical chemistry, and the other one is the pharmacology and physiology. Okay. So they both used to be 1 paper, that is the paper 1. And in paper 2, there used to be pharmaceutics and therapeutics component. Okay. So in paper 2, there will be pharmaceutics and therapeutics component. So pharmaceutical chemistry has got 30% weightage in paper 1, and physiology and pharmacology will be having like 70% weightage. Whereas in paper 2, pharmaceutics will carry 30% weightage, and therapeutics will carry around 70% of weightage. But now coming to the new exam pattern, that is the OPRA exam. So in the OPRA exam, so they have split into different components. Okay? So the content is further split into different components, and accordingly, they have allocated the weightage or the percentage. So the first one is biomedical sciences. So for biomedical sciences, the weightage is 20%. And then the second one is the medicinal chemistry and biopharmaceutics, which carries 10%. Then the third one is the pharmacokinetics and pharmacodynamics, which carries 10%. The fourth one is pharmacology and toxicology, 15%. And the last one is therapeutics and patient care, which carries the highest percentage of 45%. So here, if we notice, like further, if we have a look in the individual content, okay, what is the topics which are covered in individual content, like in biomedical sciences, what are the topics covered in medicinal chemistry and biopharmaceutics? So what are the topics covered in pharmacokinetics, pharmacology, in therapeutics, what are the topics which are covered? Okay. So when we compare the topics from the previous, like from the KAPS exam pattern, okay, so there is a variation in the topics as well. Okay. So let's say, for example, if we talk about the chemistry part. So in chemistry part, if you look at the KAPS exam pharmaceutical chemistry, so in pharmaceutical chemistry, in KAPS examination, they have included SAR, they have included about the nomenclature process, they have included about stereochemistry. So all the things were there in KAPS pharmaceutical chemistry, but in the new exam pattern in OPRA, so such things are not included. Okay, even in the other subjects as well. So they have reduced a lot of non-clinical component subjects. Okay, so they have reduced a lot of things from the non-clinical component. Okay, but they have increased more towards the therapeutics and clinical component. It means that which is required for the Australian pharmacist. Okay, so the topics which are required are the things which are required for the Australian pharmacist. Okay, so they are going to assess mainly on those things. Okay, so rather than all those biomedical sciences and all the basic subjects. Okay, so now the in OPRA exam they are going to assess more towards the therapeutics. Okay, so that is more towards the clinical oriented things. Okay, so this is the information that what it has been provided in APC official website. So it means that the pattern has been changed. Okay? So from 2025, all the candidates, those who are preparing for the exam, the licensing examination. So they must follow the OPRA exam pattern, OPRA exam content. Okay, so they must follow through the OPRA exam syllabus. So they should not follow the KAPS exam content. Okay? So KAPS exam content will no more be valid after 2025, like after November. So it won't be valid. So these are the few things that I would like to share. Okay, and now I will stop this presentation and we'll continue with the questions, Neha.
Thank you, sir. Thank you so much. And I can see a huge difference in the syllabus with the blueprint
Yeah,
and the
yeah.
paper 1, paper 2, the division
blueprint,
of the subjects, the percentage and all.
exactly,
Yeah.
exactly. As you mentioned that in the blueprint, when we look at the blueprint, there is a huge difference in the syllabus. Okay? So the syllabus is changed. Now they have mainly focusing on the therapeutics and the patient care. Okay? So which is not much there in the previous KAPS examination, like in the KAPS pattern.
It's different actually. And moving to the next question, I would like to tell the timeline. I would like to thank that. Like, apart from the team, the amount of hard work you have done from the morning to give this authentic and organic information for the students is truly inspiring, sir. And
Thank you so much, Neha.
like
And
we
even like
once again
as
we
I
proved
mentioned,
that.
when I was working there in the hospital, like everyone were discussing about this new exam pattern. So all the pharmacists, so they were discussing about this new exam pattern. So they were talking about so how it's going to affect the overseas pharmacists who are going to appear for who are going to plan to migrate to Australia. So these were the things that there was a discussion which was going on with my colleagues support there.
So
And
once again, we
like,
proved that Elite Expertise is committed to give the authentic information and help the pharmacist. And coming to the next question, sir, like for the fees of KAPS, it was 2290 Australian dollars.
yeah,
Like,
exactly.
what is the change of fee structure for this new exam, sir?
So as I mentioned in the slide, like it was like 2190. So they just reduced some amount. It is not a huge difference, but slightly the fees has been reduced for the new exam pattern, for the new exam OPRA exam.
Okay. And the last exam of this KAPS, sir, like when is the last exam for this KAPS?
So as it is mentioned officially in the APC website, like the last exam for the KAPS exam, they are going to conduct in November. So November 2024 will be the last KAPS exam. Then after that, there will be no more KAPS exam. So from March 2025, so they are going only through OPRA pattern, OPRA exam. Okay. So November 2023 will be the last KAPS for the candidates, for all the overseas candidates, those who are planning to appear. So for them, November 2023, sorry, so 2024, the coming November will be the last KAPS pattern. And in case if they want to appear for the exam, APC exam, then they need to sit for the OPRA exam.
Okay, so can a candidate resit for the exam, sir, after this November for the KAPS if they fail in one or two papers or both papers as well?
Yeah, it is officially mentioned in the APC website that in case if a candidate fail in one of the papers, let's say for example, if a candidate has passed paper 1 in November exam and has failed paper 2 in November exam, then that candidate will be having two options. Okay, so either they can sit for paper 2 of KAPS in the coming March 2025, or if they want, they can also sit for the OPRA exam, OPRA exam. Okay, so there will be two options. So they can sit for the paper 2, the one that they have failed. Okay, or if they want, they can go with the OPRA exam. Okay, the new pattern exam. But every like yes. I can say that like everyone, they are familiar more with the KAPS exam, and when the candidate is preparing for the KAPS, okay, so the candidate will be more familiar with the KAPS exam pattern, and the candidate will be like already if they have prepared, then it becomes much easy for them to sit for the KAPS, to resit for the KAPS in which the in one of the components in case if they have failed. So if they can resit for that paper, it would be much easier for them rather than they sit for this new pattern exam, that is the OPRA.
Okay. And the next question is like, for KAPS examination, we need to do eligibility check prior to sitting KAPS exam. And once we get clearation from APC, we can book a KAPS exam. Is there any changes in the registration process, eligibility check, in this OPRA exam, sir?
Yeah, again, it is the official information from the APC website that there is no change in the eligibility process. So APC is going to conduct the same eligibility process. So like how they have done for the KAPS examination. So they are going to do the same eligibility process, like the candidates, they need to send all the documents, and the case officer will be assigned, and the case officer will go through all the documents. And if everything is perfect, then they will give eligibility to sit for OPRA exam. So they give the eligibility to sit for OPRA exam. So like same how the candidate they have done for the KAPS, so the same eligibility steps will be involved even for the OPRA exam. So there is no change in that process.
Okay, is it same for the New Zealand too, sir? Like the same transition from KAPS to this OPRA for New Zealand as well?
Yeah. So they have mentioned that even for New Zealand, so they are going to from 2025 March, so they are going to start OPRA exam pattern. So there won't be any more KAPS exam even for New Zealand. So even for New Zealand, the candidates those who are aspiring to migrate or to become a pharmacist in New Zealand, even they need to sit for the OPRA exam. Okay. So there won't be any more KAPS for them as well.
Yeah, thank you for answering my question, sir. And here is Lily, who will take over from now on. Thank you.
Yeah, thank you so much, Neha.
Hi, sir.
You.
So I
Hi,
also have
Lily.
hi, sir. So
How
I
are
also
you?
have some questions
Yeah.
that students were frequently asking these questions, sir. So what is this last date for registration for KAPS exam?
The last date for KAPS exam registration is coming October 8th. Okay. So October 8th will be the last date for KAPS exam registration. Those who are planning to sit for the November KAPS exam, so they need to get the skills assessment done. Okay. So they need to get the skills assessment done. And if everything is done on time, okay, and if they get the skills assessment and if they get the eligibility to sit for the KAPS exam, okay, so the deadline for them is 8th of October. So if they can make the payment by 8th of October, then they can sit for the November KAPS examination. But if they get the eligibility on 9th of October, then they can't. So they need to go only with the OPRA exam for March 2025. So before 8th of October, if they can able to get the eligibility done, then they can sit for this KAPS examination. And after 8th, the doors are closed for KAPS. They need to go for OPRA next year.
So is this new OPRA exam paper-based or computer-based?
So they mentioned that it is completely the same pattern, like how the KAPS examination, it is the computer-based. Again, Pearson will be conducting the exam, and the candidates, they can sit the exam from overseas as well. Okay. So there is no change in the exam system that they are conducting. Okay. So like the same Pearson will be conducting, will be hosting the exam, and like
what about
even
the centers?
like how sorry.
Centers, exam
The
centers?
centers will be the same. I guess the centers will be the same. Again, as it is conducted by the Pearson. So like in India, we got many Pearson centers, and all over the world, there are Pearson centers. So again, it will be hosted by the Pearson. So there won't be any change in that system.
Okay, sir. So what is the number of attempts for OPRA for Australia, sir?
So again, in the Australian Pharmacy Council website, they have mentioned that for Australia OPRA exam, so there are unlimited attempts. So let's say, for example, if the candidate fail in their first attempt, then they can sit for the second, third, and subsequent attempts. Okay, similar to that of KAPS, like how they are giving the eligibility now. Okay, so how they are giving the eligibility. So in case if candidate has failed in the first attempt and unfortunately they also failed in the second attempt, they can go for the third and fourth and so on. So there is unlimited attempts for this OPRA exam. Okay, so this is what it has been mentioned in the APC website.
So the next question is, what is the validity period for OPRA exam?
And even for validity period, they have clearly mentioned that there is no change in the validity period. Okay, so like for KAPS examination, the validity was 3 years. Okay? So after getting the KAPS exam score, the validity for the KAPS examination was 3 years. Okay? And even now for OPRA exam, the APC has mentioned that they are not going to change the validity. The validity will remain the same. So it means that we can expect the same 3 years validity for OPRA exam. So after passing the OPRA, so again 3 years validity.
So next question is actually an important question. So many students were asking this question. So what is the pass mark criteria or scoring pattern for OPRA exam?
Okay, so now guys, like when it comes to scoring system in OPRA exam. So before going to the OPRA, so I just want to discuss the scoring system in the KAPS. Okay? So we all know that in KAPS examination, the scoring was like 50%. Okay? So in paper 1, the candidates, they need to score 50%, and in paper 2, the candidates, they need to score 50%. And also in each component, like in pharmaceutical chemistry, they need to score 50, and pharmacology and physiology, they need to score 50. Okay? Like in individual components, they need to keep on scoring 50, 50, 50, and overall 50. Then the candidates, they will pass the exam. Okay, so that was the scoring pattern for KAPS examination. But for the new exam, the OPRA, they have changed this scoring system. Okay, so they have included a new scoring system, which is known as the scaled scoring system. Okay, so I would like to explain a few things about this scaled scoring system. How does this system it works, and what candidates they need to expect, because these are the things like even they have texted me, few of the candidates, they have texted me. So what is the pass percentage or the passing mark for this new OPRA exam? Okay, so there is no certain passing mark, okay, or the passing percentage for OPRA exam. Okay, so as it is completely based on the scaled scoring system. Okay. So there is no certain passing percentage of the score. Okay. So as I have mentioned that in KAPS examination, 50% is the scoring percentage. Okay. The candidates, they need to score 50% in each subject and also 50% overall to pass the exam. But in OPRA exam, it is completely scaled scoring. So what is scaled scoring is, so this system that they use for most of the examinations, like SAT exam, as well as in other examinations as well, like in BCPS, in PBC, and other exams. So they use this scale scoring. Even CAOP exam also, they use this scale scoring system. And in this system, what they do is, like, let's say, for example, if there are 2 candidates who are appearing for an exam, which is 100 MCQ based exams. Okay, so and candidate A has scored 75 correct answers, and candidate B also scored 75 correct answers. Okay, so both the candidates have appeared for this computer-based exams. Okay, and what happens in this computer-based exams is we all know that there will be multiple versions of the test. Okay? Like if a candidate who sit the exam in Melbourne, okay, so we'll get a different paper from the candidate those who sit the exam in Bangalore in India. Okay, or the candidate those who sit the exam in Dubai. Okay, so everyone, they will get different sets of papers. Okay, it means that there will be multiple versions, and these exams will be conducting like on different dates as well. Okay, so the candidate, those who are sitting the exam on day 1, they will get a different set of paper or a different version of paper, and on day 2 they will get a different version of paper. Day 3 they will get different version of paper. Okay, so everyone, they will get different versions of papers, okay, or different sets of paper. So now let's assume that 2 candidates, those who have appeared on day 1 and day 2, okay, with they both got different versions of papers. Okay, but both the candidates have scored 75 out of 100. They have scored 75. Okay, But candidate A has passed the exam, but candidate B hasn't passed the exam. Okay, so now what happened? Okay, so how it works is, so it is based on the scaled scoring system. So what happens is, so based on the score that the candidate they get after getting the score, okay, so here they will do equating process. So equating process is nothing but they will assess the how the candidate's performance in that version of the examination. Okay, so how the candidate has performed in that particular version or in that particular test that he got on day one, okay, or the particular version of the exam that he got on day one, and how the candidate has performed in the particular version of the test that he got on day two. Okay, so in this way they will do the equating process. So once the equating process is done, okay, so now both the candidates have got 75, 75. Okay, so let's assume that the candidate A has got a little bit of tough papers, tough questions, okay, and he has scored 75 out of 100. Okay, but candidate B has got some easy questions, but still he has scored 75 out of 100. Okay, so now what happens is for candidate A, in order to pass the exam, 75 is enough. Okay, so after scaling, scaling and equating, okay, so for candidate A, in order to pass the exam, 75 is enough. Okay, but for candidate B, who got the easy paper, easy pattern, okay, so in order to pass the exam, he need to score 85 or 90. Okay, so that's how the candidate A will be passed and candidate B will become unsuccessful. So this is about the scaled scoring system, and this system is implemented in the new exam, that is the OPRA exam. So it means that if a candidate gets a easy paper and if they are answering all the questions, they should not get much excited. They should not get much excited that they can pass the exam. So anything can happen, okay, because those who got the easy question, it means that they threshold or the target will be more higher. Okay, they need to score more and more answers. Instead of 75, they need to score up to 85 or 90 to pass the exam. And those who have got a tough paper, okay, and they should not worry much, okay, because those who got the tough paper, their threshold will be very low. Okay, their scoring target will be very low. Okay, so they may pass even at a very low score. So this is how it is known as the scaled scoring. So earlier, like till in KAPS examination, the scoring method is known as the RAS scoring. So RAS scoring is nothing but if you score 50%, you will pass the exam. Okay, so irrespective of the exam or irrespective of the paper, like for example, if you have got a tough paper, okay, and I have got the easy paper, so I have scored 50% in my easy paper, I will pass the exam. But you got tough paper, okay, so that's why you have scored only 48 or 49%, so you have failed the exam. Okay, so that's what is known as the RAS scoring. So that's what is there in KAPS examination. So in KAPS examination, like the target is 50%. You must score 50 to pass the exam. But in OPRA, it is completely scale scoring system. So this is the one that candidates need to worry a bit. Okay, so otherwise, yeah.
So better to get tough paper, right? So we have to pray that we should get tough paper.
No. It's not like always we must get the tough paper. It depends on the situation, and even if we get the easy paper, so the thing is that we must score highest in that. Okay, so if our preparation is stronger, then we need not to worry. Even if we get the tough paper or the easy paper, definitely we will score and we can pass the exam.
Yes, sir. So coming to the next question. So is the syllabus for KAPS and OPRA same, or are there any changes in the syllabus?
Yeah, there are some changes in the syllabus as I have displayed in the slide before. So there are some changes in the syllabus and the pattern. So like earlier, it was 2 papers with pharmaceutical chemistry, physiology, pharmacology, pharmaceutics, and therapeutics. But now it is completely changed to biomedical sciences, okay, and so on. So the syllabus is changed. Okay? and the exam pattern is changed, and the scoring system is changed. So these are the things that which have been changed.
So next question, sir. Will there be any break in the OPRA exam like in KAPS exam?
No, because it is only one paper. So for one paper, there is no break. So if it is two papers, then they might have considered. Okay, but for OPRA exam, it is only one paper, which should be done in 2.5 hours. Okay, so there is no break at all.
Sir, that's all with my questions. I'll Ashrita will take over.
Okay, thank you, really.
Yes, sir.
Thanks
you.
for
Thank you
that.
for answering.
I've got some set of questions, sir. So when will the registration for the exam will get start?
For OPRA,
Yes, sir. For the OPRA, when will the exam registration start?
as it was mentioned that from 9th of Jan, okay, so
Okay.
officially they are going to start the registrations, okay. But here, as I mentioned that, so on 9th of Jan, the registration in the sense, the candidates must get the eligibility check. If the candidates have got the eligibility check, okay, so by 9th of Jan, then they can book for the OPRA exam. Okay, eligibility check in the sense, if now itself they need to start for document evaluation, okay, because nowadays APC is taking like more than 2 months time for the document evaluation, and even it depends on the candidates, in case if there is any discrepancy in their name, then they need to submit further documents, okay, like one and the same certificate, and all these things it will affect. Okay? So it will affect the time frame. So the candidates, they need to start applying for it as soon as possible. Then if they get if they get the eligibility to sit for the OPRA exam, then they can start. The registration starts on 9th of Jan and it closes on 3rd of Feb. Okay. So it starts on 9th of Jan and it closes on 3rd of Feb. So it means that before 3rd of Feb 2025, if the candidates, if they get the eligibility to sit for the OPRA exam, then they can book for March 2025 OPRA exam.
Okay. Sir, $1 million question. Is KAPS easy or OPRA easy? Or KAPS tough or OPRA is tough? Which is tough, which is easy?
Like we can't say that which one is going to be easy or which one is going to be tough, because this is the first time the pattern for the OPRA. So here, I just want to discuss few things about the pros and cons of this exam. Okay, so as per my perspective, okay, I just want to share a few things with the candidates, okay, those who are planning to sit for this OPRA exam starting from March 2025. So in OPRA examination, when compared to the KAPS, okay, so they have reduced the syllabus in the basic sciences. Okay, so like in chemistry, they have reduced the content. In other minor subjects also, they have reduced the content. Okay? And they are focusing more towards therapeutics. Okay, so more towards the therapeutics, and that is nothing but applied. That is the clinical oriented. Okay? So they are focusing more towards the therapeutics. That is what it's required for Australian pharmacist. Okay? So that is what it's required for the Australian pharmacist. So they are planning to assess mainly on those things. Okay? So what?
So will it be like a conceptual exam, sir? Will it be like a conceptual exam, the real-time experience and everything?
Exactly. So that's what it's mentioned in APC.
The website and
also they are doing the methodology similar to that of the CAOP.
Okay. What is CAOP, sir?
CAOP is the exam for those who are already registered in US, okay, and registered pharmacists in US or UK or Canada. In case if they want to migrate to Australia, okay. So like let's say for example, if candidates from India or any other countries, okay, Pakistan, India, Bangladesh, Nepal, from Middle East, from all the countries. So if they want to become a pharmacist in Australia, they need to sit for KAPS exam. KAPS are the new OPRA pattern.
Yes.
But for candidates, those who are already practicing in the Western countries, other Western countries like in US or UK or Canada, okay,
Okay.
So for those candidates, if they want to become a pharmacist in Australia, so they will be having a screening examination that is nothing but the CAOP. Okay, that is
Oh,
the
okay.
competency assessment of pharmaceutical sciences for them. So that is known as the CAOP exam. So for them, the pathway is the CAOP.
Okay.
And the methodology what they use in CAOP or the methodology what they are going to use in the intern pharmacist exams. Okay? So even while they are doing the internship here, so they will be having two exams. One is the intern pharmacist written exam and the intern pharmacist oral exam. Okay? So the methodology or the pattern that they are going to use in CAOP or the intern pharmacist written exam, so they are going to implement the same methodology in OPRA.
Okay. That means it will be a next level of bringing the knowledge.
Exactly. So it will be
Okay.
a next level, and as per uh, as per the information that I have gone through the APCs.
Yes.
So I assume that like they are going to add more towards the clinical side, like the application side. Okay?
Yeah.
More towards the therapeutics, that is more towards the application side, which is much required for the Australian pharmacist. Okay? So in KAPS, what they did was most of the questions were just knowledge-based questions, but now they are using the Bloom's taxonomy. Okay? So where the classification, like we know in Bloom's, the first level will be the knowledge-based level, and then the second level will be the comprehensive level, and then the third level will be the application level. Okay. So in a similar way, in OPRA exam, they have divided it into the questions into three sets. Okay. So knowledge, which carry around 55% of the questions, knowledge level in the sense where they will ask about the basic things. So what is the mechanism of action of furosemide? So what is the, among the following, which drug will cause myopathies? Okay. So such a basic questions that already we know by looking at the question, can give the answers, straight away answers. Okay. So those are known as the knowledge-based questions. Okay. So they are going to implement 55%, only 55% of the knowledge-based questions, and the rest of the questions, the 45% rest of the questions will be comprehensive, and it will be application-based questions. Okay. So with the candidate, they need to apply their knowledge. So it's not just studying. Okay.
So
they need
everyone must be like Arif sir and Harika ma'am, I believe.
it's not like that. So where the candidates, they need to apply their knowledge. Okay, and that thing, and other interesting thing that I forgot to highlight here is when I mentioned that for OPRA exam, the number of questions is 120 MCQs. Okay. 120 MCQs. So the candidates, they need to answer it in 2.5 hours. Okay. But out of this 120 MCQs, only 90% of the MCQs will be scored. Only 90% of the MCQs will be scored. Okay. And the rest 10% will be unscored. Okay? The rest is unscored. So here, 90% of the MCQs means out of 120, roughly around 108 MCQs will be scored. Okay, and 12 MCQs will be unscored MCQs. It means that here we don't know which MCQ is an unscored MCQ. Randomly, you will get that MCQ. So in all the 120, so there will be 12 MCQs, like 10% in the sense, 12 MCQs. So 12 MCQs will be unscored MCQs. It means that we can say that in a normal language, you can say that they are the dummy questions. Okay. So here again, the problem it arises. Okay. So like if a candidate has answered more of those dummy questions, those unscored questions, there is no use of it. Okay. The score will be calculated only from 90% of the main questions. Okay. So that 10%, that is the 12 MCQs, what they are going to include. And we don't know which MCQ is the dummy question, which MCQ is the unscored question. Okay. And those questions, they will be shuffled. Randomly, they will be shuffled. They won't come in a sequence. So they will be randomly, they will be shuffled. So no one can expect that which question is a scored question and which question is an unscored question. Okay. So let's say, for example, if I got like around 6 or 7 questions from one of the subjects. Okay, let's say for example, if I got 6 or 7 questions from pharmacokinetics, okay, and I thought that, oh, I answered all the correct questions, all the questions were correct. Okay, out of those 6 questions, there might be few unscored questions as well. That is, dummy questions will be included. So this is the pattern that they consider even in PEBC and other standard examinations. So now they have introduced this pattern in OPRA. Okay.
Okay.
So there are 2 difficulties that the candidates they will face.
Okay.
The first difficulty is they don't know which question is the unscored question. Okay. So only 90% of the questions will be scored. Okay. So out of this 90% of the questions, again, they will enter into scaled scoring system.
Okay.
So scaled scoring system, they need to enter from this 90% of the questions. The dummy questions are dummy questions. They automatically, the computer will remove those things.
Okay.
The remaining questions, what will be the 90% of the questions are there, like 108 questions. So now the candidates score, now it will calculate the scale scoring system only for this 108 questions, not for the 120. It will calculate the scale scoring system for 108 questions. So they will calculate the total score. I'm telling you about the scale scoring. What is the process that they use scale scoring? In scale scoring, like the computer will calculate the total score, and then it will do the equating process. So when it does the equating process, again, it will check the test version, the candidate that has appeared. Okay, so it will check the standard, the test version, how difficulty the test version that the candidate has appeared. Okay, so based on that, the computer, if the computer has set the standard, the passing score at 80 for that particular test version that you have appeared, okay, and for that particular test version, you must score 80 in that exam. Okay. So a few difficulties that I can say they will face. Okay. So, and however, like this is the first batch, like those who appear in the March.
Yeah. Yes.
Once after getting the March batch exam, and only will know.
Get to know about it.
Yeah, but this is the scoring system. So 120 MCQs, only 90%, that is 108 will be scored, and 12 questions will be dummy questions, that is unscored questions. Okay. And candidates, yes, Rakesh.
How do we come to know which question is a dummy question? How do we come to know?
That's the challenging, Rakesh. So no one will know that which one is the dummy question. So which one is the unscored question? So just you will see all the 120 questions, like eventually you will keep on doing all the 120 MCQs. And after doing the MCQs, you don't know which one is the scored MCQ and which one is the unscored MCQ. Okay. So only computer knows which one is the dummy question. Okay. So only computer knows that which one is the unscored question. Okay. So it will automatically remove all those unscored questions. Okay. Now only the leftover questions will be 108 questions. From this 108, again, the candidates, they need to enter into the scale scoring system. Okay. After scale scoring, the scale scoring is done, then it will calculate, or it will enter into the equating process, and finally it will give your particular target score in that particular version of exam. So you have appeared the exam on 3rd of March, okay? And Rakesh has appeared the exam on 4th of March, and Neha has appeared the exam on 5th of March, okay? Or Rakesh has appeared the exam in Delhi, you have appeared the exam in Hyderabad. Everyone have got a different set of papers, different version of papers. Okay, so everyone have got different version of papers. Now everyone should have your own target of scoring. Okay, so Rakesh's target will be 75, Neha's target will be 80, but your target will be, it may be 85 or 90.
Yeah, understood.
So this is known as the scale scoring system, which is
it's a bit tough, but you have negotiated it, like you have explained this in such a way that it's very understandable, Arif sir. I don't know how much time you can for doing the research and all. We have other question as well, sir.
So before that, sorry, before I jump on to the other question, so I forgot to explain about what are the pros of this exam. Okay,
yeah,
so the pros of the exam is, like I can say that APC has done a very good initiation. Okay,
Yes.
it has
Yes.
really done a very good job. Like it has introduced a new system, new pattern. Okay, so which is much essential for the Australian practicing
Pharmacist.
pharmacist. Okay,
Yeah.
if the overseas pharmacist, if they have already cleared this exam, it means that they are ready to practice in Australia. So that's the main concept. Okay, so it is known as the overseas pharmacist readiness assessment. Okay, so it means that if a candidate like has passed this exam, it means that he has a versatile not only
Yeah.
knowledge but also application standards,
Yes.
application capabilities. So these are few pros, and also the main important thing is that the candidates, they need not study all the basic subjects. So if they can focus only on the main therapeutics and whatever be the things that are mentioned, so if they focus on those things, then that would be much easier. Okay, so these are the pros, but when it comes to the scoring system is completely changed. So that's the main cons that we need to consider about it.
Yes. Even the name changed, the meaning changed, entire notation changed.
Yeah, it is.
Can I jump into the next question, sir? Is it okay?
Yeah, you can.
So, sir, for suppose I have done my skill assessment and I'm ready to go for this November exam, and I feel like I'm stuck, and I feel like maybe I can jump into March. So, can I continue with can I continue writing in November, or what do you advise us? Like, what is the last day for registration for the KAPS exam?
So the last date to register for KAPS examination is October 8th. So October 8th
Okay.
is the last date to register for this KAPS
Okay.
examination. In case if you have got the eligibility before October 8th, okay, so it means that you can immediately book for the KAPS exam slot, okay, and you can appear for the KAPS examination, which is going to be held in November. Okay.
Okay,
So
sir.
otherwise, even if one day gets delayed, if you get the eligibility on 9th, then there is no use. So you must sit for the new exam pattern, that is the OPRA.
Okay. Understandable, sir. Sir, and whatever the eligibility checks we have done now, it doesn't have any expiry date as of now
Yeah,
till
the
date.
eligibility is the same. The eligibility check is the
It's the
same. So
same.
there is
Okay.
no expiry for the eligibility. Okay. So
Oh, okay,
it
sir.
still remains the same. That is no expiry for eligibility. But
Yeah.
what are the latest eligibility that they are going to give? So they will be giving only for OPRA exam. Okay, for all the new candidates, they will give only for OPRA, no more for the. In case if they get the eligibility before 8th, then
Okay.
the eligibility for the KAPS. But after that, all the candidates, they need to go only through OPRA. There won't be any further KAPS. Unless the candidates, if they have failed one of the papers in KAPS examination, and if you want to resit for that paper, so for such candidates, there will be a chance to for the KAPS examination again.
For the new candidates, it's a clear-cut OPRA.
OPRA, yeah. For the new candidates, it will be clear-cut OPRA.
Clear-cut OPRA.
For the old candidates, those who have failed in one of the papers in KAPS, so they will be having a chance to resit for the KAPS. So they will be getting two options, either to resit the KAPS or to OPRA. So if they want to resit for the KAPS, they can go with the KAPS, or if they want to resit the OPRA, then they need to take the 120 MCQs question paper of OPRA.
Okay. So if for KAPS you don't have any attempts, it's a very nice, easy, breezy job. Does OPRA have any attempts kind of a thing? It's like for me, candidates who are very below average.
Even for OPRA, there is no such limitation. So they have clearly mentioned that even for OPRA, you can do n number of attempts. Okay. For Australia, you can do n number of attempts.
Okay. For New Zealand, sir?
For New Zealand, again, only 2 attempts.
Oh, there is a okay.
Yeah, for New Zealand, only 2 attempts, but for Australia, so we can you can give n number of attempts. It doesn't matter.
Yeah. Sir, and for the OPRA exam, are they concepts like can a candidate expect any questions from the law kind of a thing?
The Australian law,
Yeah, Australian law.
No. For OPRA, in OPRA exam, in APC, they have clearly mentioned that they won't be including any of the Australian legal and law and ethical practice questions. So all those law and ethical practice questions, the legal and ethical practice questions, so they will include in the written examination when the candidates they are doing the internship. Okay, in the written examination, so they are going to include those questions, but not
Okay.
in the exam.
Yeah. So I guess I'm done with my questions. You have answered all my questions very, you have done so much of research. I've got these questions from particular students who are sitting. And over to you, Sahana.
Thank you, Ashrita.
Pleasure, sir. Bye, sir.
Bye.
Hi, Arif. It's been
Hi,
a hectic
Sahana.
day
How are
for
you?
you. I know you woke up early with this news, and you called us all, and none of us was picking up the calls, tired with the results and everything. And
Yeah.
you made an attempt to find out all the details all by yourself, and such effort that you put into all this is shown in the results of the students. So congratulations for
Thank you so much. Thank you
96%
so much,
pass
Sahana.
percentage. Yeah.
Thanks a lot.
From everything that I've heard prior, I'm really curious to know about the one thing that is a negative marking, because it becomes a compulsion for all the students to attempt all the questions, since there are 10 dummy questions and you don't know which one is a dummy question and not.
Exactly.
So it becomes a compulsion for the students to attempt all of them. If there is a negative marking, then that would be a problem for the students. So could you throw some
Exactly.
light on it?
So yeah. So there is no negative marking, as which is mentioned in the APC website. So there is no negative marking, but the only thing is that out of 120, there will be 10% of the questions will be unscored questions. Okay, so which means that around 12 questions are dummy questions. So candidates they don't know which one is the scored question and which one is the unscored question or the dummy question. So that's the only challenge that the candidates they will face here. Okay, but there is no negative marking. Okay.
Yeah, that's some good news for the students.
Yeah. That's at least the candidates can relax in this
Yeah.
aspect. So there's no negative marking. So, but
Yeah.
in case we have also included the negative marking with this 10% of the unscored questions and scaled scoring system, then it becomes much tougher for the candidates to clear the exam. If all
True.
these things get implemented, then it becomes much tougher. So at least there is no negative marking. So that's the good news.
Yeah, that is. Also, many of the CAPS qualified candidates who have already passed their exam, CAPS exam, are very curious about what would happen next. How would this transition affect them from CAPS to OPRA?
No. For CAPS candidate, those who have already cleared the CAPS examination, they need not to worry about this new exam pattern. Okay? So they need not to worry about this OPRA. So for in case if they have already cleared the CAPS, okay, so they have the validity for their own exam. So they have the validity for their own CAPS examination. That is 3 years validity is there. Okay, so it means that they can register with APRA. And they can become when they register with APRA, they will get their provisional license and they can practice their internship. Okay, so for already clarify, so those who have already cleared the CAPS examination, for them it doesn't apply. So they need not to worry at all. Okay, so because they already got the 3 years of eligibility, and APRA, I'm talking about the APRA, that is the pharmacy board. So APRA will consider the CAPS exam score. Okay, it will still consider the CAPS exam score. Okay, for the candidates till November 2024, those who are whoever they sit for the CAPS, APRA will consider the CAPS exam score. Even for the previous candidates, those who have done the CAPS examination in 2023 as well. Okay, even for them, APRA will still accept the CAPS score. So only from 2025 March, for all the new candidates, APRA will ask the OPRA exam score. APRA, OPRA.
Yeah. So it is this question was asked by many of the CAPS qualified students, because yesterday was the result and today there is a
Yeah.
change. So most of the students were worried about what is going to happen and all of that. So yeah, the next question from is also very curious question from all the CAPS qualified and students and everybody. that do employers place a higher priority on the OPRA exam? How is the priority from the employer's perspective going to be? Will they consider OPRA or will they consider CAPS qualified students?
Yeah. Okay. So I guess like most of the candidates are worried about this thing, okay, because APC has mentioned in the website that they are going to implement a new system which is more adaptable in Australian practice. Okay, that is the OPRA exam will be more adaptable to Australian practice system. Okay? So that's why they are going to start this exam, okay, OPRA pattern. But
Okay.
as employer perspective, employers, they don't care whether we have cleared the CAPS or OPRA or anything. Okay, so they want an intern. So they want an intern pharmacist to hire. Okay, so what they look is they will look at the candidates APRA registration if they have got the provisional license with them. Okay, APRA registration. If a candidate has got the APRA registration, then the employers, they won't worry about what is their qualification. So what is their like what through which pathway that they entered into here. Okay, so they won't worry about those things. So just the two things that they check is, have you got the APRA registration? Have you got a provisional license through APRA? And then do you have a valid visa? Okay. So these are
Okay.
the only two things that the employers are worried about. Okay. So they don't worry about whether we have done the Form D, whether we have done the B Form, Masters, CAPS or OPRA. So all these things, it doesn't matter for them. So candidates, they need not to worry about it. So those who have cleared the CAPS examination. So if you get registered with the APRA and get your provisional license, okay, so you will be like treated the same as that of the new exam pattern, that is the OPRA exam pattern. So yeah, it is an interesting question, but yeah, the candidates, they need not to worry about it. So both the exams will be the same because employers, they will consider both as the same. So employers, they just need the APRA registration, that is the provisional license.
Yeah, that's some insightful information from you, Arif. I have one more very, 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 most frequently asked question, I would say, because most of them have cleared their B Pharmacy and are eligible now for the CAPS, and they're prepared for CAPS for such long time. And most of them have their question: should I wait for OPRA exam or should I continue with CAPS? So could you throw some light on it?
Yeah. So like those who have already decided to appear for the exam and who have been like already planning from a long time and getting their document evaluation done. Okay. So for all those candidates, I recommend to go with the CAPS. Okay, as in the November, they are going to conduct the last exam for the CAPS. So you can go through the CAPS. So you need not to wait for the OPRA exam, which is a new pattern and new scoring system and so on. Okay. So if you are already done, your skills assessment is done. And even if you have it done, then if you can start doing your skills assessment, and if you get the eligibility by before 8th of October, okay, then you can sit for the CAPS examination. Okay. Otherwise, you need not to get much stressed. Okay. So in case if you don't get the eligibility, then what we can do? So we need to appear for the next exam, that is the OPRA exam in March 2025. So yeah, in case if you get the eligibility, do it in November. But in case if you don't get the eligibility, then need not to stress. You can sit for the OPRA exam in March 2025.
Yeah, you have cleared this very much because they are very much worried about their career aspect. And the
Yeah.
next question is, will this single paper format, because the CAPS had two papers, like part one and
Yeah.
part two, but now we have a single paper format. So will this be easier or hard? How is it going to be?
So as per the official website of APC, which is mentioned in the APC, they mentioned that the exam standard, okay, so the OPRA exam standard, it remains the same as that of the CAPS. Okay, so this is the one point. So they have clearly mentioned that the exam standard remains the same as that of the CAPS exam. Okay, but when it comes to like including these dummy questions, Okay, so 10% of the questions will be unscored questions, and also starting the scale scoring system. Okay, so all these things will, we are not sure how it's going to affect on the final result. So we need to wait and see how the result comes in the March 2025. So we need to be prepared for it. Okay, so these are the things. Okay, but the exam pattern, they mentioned that the standards, they remain the same, but by introducing the scale scoring and adding those 10% of the unscored questions, okay, so definitely it's going to affect the candidate's result. Okay, but in case if the candidate is well prepared for the examination, then they need not to worry at all. Okay, so because these are the things that are already there in already there in other exams as well. Like already they have doing it in CAOP. Okay, CAOP exam. Already they are doing it in intern pharmacist written examination, Australian intern pharmacist written examination. So already they are doing it in this type of adding the dummy questions. They are doing it in Canadian examinations. Okay, but all the candidates, they are still clearing the exams, so we need not to worry. And because I can say that even our intern candidates, they have got the same pattern, like there will be 10 dummy questions, and they need to score 90%, only 90% of the questions will be the score questions, and again scale scoring system will be there. Okay, but still all our candidates, intern pharmacist candidates at Elite Expertise, 100%, they have 100% candidates, like not even in KAPS, like we can say that 94%, 95% or 96%, but intern pharmacist written examination, all the candidates at Elite Expertise, they have cleared their examination. So it's nothing but it's completely depends on the efforts that we put towards preparing the examination. And if we are well prepared, if we are well prepared, and we need not to worry about all this scale scoring and all these things. So definitely the candidates, they will pass the exam.
That's great. Since you are there for the preparation, we need not worry much about it. So you will train us anyways. I'm sure about that. There's one more question. In the APC website, there are some sample papers saying that these are the OPRA exam papers. So is it going to be similar to the sample papers that is provided there?
No, like again, APC has clearly mentioned it. It is just considered as the sample question. So you should not consider this as the same type of the question that you can expect in the real exam. Okay. And I have checked those sample questions. So those are the sample questions which they have used the same things like in even for the KAPS back in 2016 to 2019. So these are the old question papers that were there in the KAPS for the KAPS as well. So these are the same questions. So I can advise the candidates that whoever are preparing for this new OPRA exam, okay, so don't rely on the questions which are there in the sample paper. Okay, so because APC has clearly mentioned, they have clearly mentioned the disclaimer that so these are just the sample model questions. Okay, so and the main exam questions will be completely different. Okay, so you guys, while you are preparing the candidates, those who are preparing for the exam, so the main thing that you need to do is you need to go through the syllabus content. So the content which is mentioned in the syllabus, so you need to go through the syllabus content. Okay? And what are there which are mentioned in the syllabus content, you must try to cover all those topics. Okay? Okay. So candidates must cover all those topics. Okay? And yeah, if the candidates, they are prepared from all those syllabus which is mentioned in the APC website, then it will be much better for them, and they can't rely on that just on that paper, the sample papers which are present in the official website of APC. So because those are the old KAPS papers, so which is mentioned for the OPRA as well.
Okay. So I have one of the most awaited questions from all our students. Like KAPS, we have scored so well. We are doing so well with KAPS and everything. Now, who is there to help us with OPRA? Are we going to start a new, is Elite Expertise going to be there to help us out, or how is it going to be? If yes, when are we going to start the new session for the OPRA preparation course?
Sure. Sure. Like definitely, we will be there. Elite Expertise will be there to support all the our candidates for all the students. So those who are preparing, those who are planning to prepare for the OPRA exam, starting from March 2025. So we are going to support them. Okay, so we will help them in their preparation. Okay, so definitely this pattern is completely new for them. Okay, for the candidates, the pattern will be new, and the syllabus, there are some changes that have happened in the syllabus. Okay, so we at Elite Expertise, so we will work out on all those things, and we will help the candidates to prepare for this OPRA examination as well. Okay? And like we are planning to start the first batch soon. Okay, so starting from 10th of August, so we are going to start the first batch for the candidates, because we are going to run the first batch for a long term, not for a short course, because this is the first batch, and the candidates, they need to know more about the concept oriented things. Okay,
Yes.
so it is not something like we can just include them in 2 months course or a 3 months course. Okay, so because everything is new, so the candidates, they need to learn a lot of things. Okay, so a
Yeah.
lot of things to be designed, a lot of things that the candidates, they need to learn. They need to start learning from the basics, concepts, and so on. Okay, so for the new topics, so they need to learn the basic concepts and so on. So that's why we have decided to start a long term course. Okay, for OPRA exam. So candidates, they can still take the admission at Elite Expertise for KAPS. Okay, so in case if they get the eligibility, they can sit for the KAPS in November. If not, they can move on to the OPRA for March 2025.
So all of you
Yeah.
guys, it's a very good news out there. Like Elite Expertise is going to start OPRA preparation course from 10th of August. Be ready to get into and enroll yourself for that program if you're still looking to move to Australia for your licensure exam. There are many questions that are asked from the audience, and I think Ashita will take it from here.
Yes.
That was very insightful, Arif. Thank you so much.
Thanks, Sahana. Thank you so much.
Sir, as a team member of Elite Expertise, I have a very personal question.
Yeah.
That in the 3.5 months training, like we have live classes which will be thrice a week for 3 hours of class for the KAP students. And yeah, there would be mocks, there would be, assignments to the students. It will be old school kind of a teaching where you and ma'am you'll not obviously have a stick in your hand, but you'll be teaching everything. So I have enrolled myself for KAPS, and Sahana has enrolled for OPRA. Will the teaching be the same, and will the pattern will be the same?
The teaching, in the sense, like for OPRA, we need to follow the new syllabus. Okay. So we need to follow the new syllabus, so which we are going to design it soon. Okay.
Yes.
And we are going to do it like within.
Yes, I know.
So for OPRA, the pattern that we need to teach the students the new concepts, the new things. Okay. So as the syllabus has changed, so we can't follow the old the current KAPS method. Okay.
Yeah.
So because in KAPS the syllabus is a bit different from one. Okay. So we need to follow we need to teach the new things. Okay. And even we are going to design the new mocks for OPRA candidates.
Okay.
So when we teach the new concepts and the new things, so definitely we will design the new mocks and also new handouts, new materials, new assignments, new team push activities. So everything will be new for
everything. So it's like if I have enrolled for KAPS and I feel like, November, I'm not going to make it because of my skill assessment. Can I jump into OPRA batch? Is it okay?
Yeah, definitely. You can jump. You can jump. There won't be any extra fees that we charge.
Yeah.
So like once you take the admission, it's our responsibility. You will be with us till you pass the examination. Till you clear the examination.
It's a good news, sir, because if I see the pattern of OPRA and the methodology, it's similar like PEBC, right? It's
Similar in the sense,
similar.
especially I can say that when it comes to the scoring system, Okay?
Yeah.
So it is just like similar to PVC. Even in PVC,
PVC.
there are dummy questions. So no one knows which one is the dummy question. Okay. So no one knows which one is the sport question and which one is the unsport question. Okay. So
Yes.
even the same thing is implemented here. So
And we have launched PEBC as well. So it will be two players playing in a court kind of a thing. One for volleyball, one for the methodology is different, but the pattern, if you see the complex of the course, sir, it has become the same for the Canadians, for Australians and everyone. Because maybe
almost like now they are going to change more towards it. Even
Yeah.
in Canadian CAPS, in PBC,
Yeah.
so you can see biomedical sciences as one of the components.
Yes.
So now even in OPRA, biomedical sciences as one of the components. So almost like we can say that the topics and the method of exam. Okay, so these are the things that have been changed for the Australian.
Yeah.
Okay, so yeah, so
we have
these
some
are
live questions, sir. Maybe I can pick top 10 questions, Arif, sir, if you're okay.
yeah, sure.
The one is, will they give much priority to OPRA while recruiting?
No, as I mentioned earlier, so for OPRA, there is no priority while recruitment. Okay, employers, they are not worried about you are coming through OPRA pathway or you are coming through KAPS pathway. Okay, so employers are not at all worried about all those things. So employers, they just see your OPRA registration, that is your provisional license. So that's the only thing that employers, they will have a look, but employers, they won't bother about the KAPS or OPRA. They won't give any priority to OPRA exam.
And are the admissions for the OPRA, the admissions are started for Elite Expertise?
So we are going to start soon from 10th of next month, from 10th of
So we can
August.
take the admission and we can fix everything out, but the classes would be from 10th of August.
Yeah. So like the candidates, they can enroll in case of the candidates, if they have got the skills assessment before October 8th, then they can sit for the KAPS, or otherwise they can go for the March exam, that is the OPRA exam.
Is there any negative marking for the OPRA exam, sir?
Yeah, no, there is no negative marking. So far, like whatever the things that I have done is enough. So included dummy questions and included the scale scoring system. Okay, so that's more than enough. So no negative marking.
Pass percentage, sir. It's for the KAPS, it is 50%. And for the OPRA?
For KAPS, it is 50%, but for OPRA, as I mentioned, so there is no particular percentage. So it is based on the scale scoring system. I guess Rakesh has got few things. Rakesh is waiting.
Yes, sir. So we are going to prepare some new material and mock, sir, for this OPRA exam, or the same. All the things will be the same.
Yeah. No, Rakesh, for OPRA, like we are going to change everything. Okay. So as the exam content is changed, okay, so we at Elite Expertise, we are going to change the material as well. So we are going to prepare the students. We are going to teach the students according to the new syllabus. Okay, so for March, those who are planning to sit for the OPRA exam for March 2025, for all those candidates, we will teach them as per the new OPRA syllabus, not with the KAPS syllabus. So for the current batch, for the current KAPS batch, we'll continue with the same KAPS syllabus. Okay? But for the coming batch, those who are planning to sit for OPRA, so for them, we will start teaching with the OPRA syllabus, by adding new mocks and by adding new handouts and assignments. So everything will be new for them.
Thank you, sir. So it will be a great opportunity for the students. November is a last chance for them. Go for the skill assessment before the end date. Then only you will have the positive skill assessment, and then only you can book your exam. So don't be so late. Those students who are confused, it's a best time to go for skill assessment, because it will take, I think, 60 to 70 days they are taking for the skill assessment, and then you can definitely book the exam for November.
Yeah, so in case if they get the skills assessment, then they can go with the same pattern, the old pattern, that is the KAPS pattern. But in case if they won't get the skills assessment, then they must go only through OPRA exam, that is the new pattern.
We have
So
a we have
yes,
a
yes.
very nice question. Sorry, sir. We have a very nice question. Will OPRA applicable to New Zealand, like initial consideration without IELTS and OET exam? Like whether New Zealand will only take OPRA, whether it will not, like usually it will have an added advantage. If a candidate writes CAPS, he should also write OET, right, for New Zealand.
Yeah.
So if it's like if I'm writing the OPRA, is it only enough for New Zealand, or can I write? Should I write OET or something kind of
Yeah, you
that?
must write the OET. So all the other eligibility criteria for New Zealand, they remains the same. Like for New
Okay.
Zealand, even for the KAPS examination, for a candidate to write the KAPS examination, to sit for the KAPS exam. So at first they need to clear the occupational English test or IELTS. Then only they will get the eligibility to sit for KAPS exam. Okay. And the same thing is applicable even for the OPRA exam of New Zealand. At first, they need to clear their English exam. So once after clearing the English exam, they will get the eligibility for OPRA exam.
Okay. You have any further questions, Rakesh? Sahana, you have unmuted yourself.
Yeah, there's one question from the student asking whether skills assessment for November exam is still available or not at Enlight Expertise.
Yes,
Yes,
it
it is
is.
still
Sorry.
available. So we still help the candidates, assist the candidates to do their skills assessment. Okay, so we'll help them to apply for the skills assessment eligibility.
There's one more question asking after OPRA exam, is it needed to give intern exams?
Yeah, intern exams are mandatory, so they are not going to remove any of the intern exams. So after clearing the OPRA exam, they need to start doing the internship. Okay, so and during the internship, again, they need to when they finish the 75% of the intern intern hours out of 1,575 hours. So they need to sit for the intern written exam and intern oral exam. But I can say that the candidates, those who come from OPRA pathway, for them, the intern written exam will become much more dead easier.
If they get enrolled in Elite Expertise.
Sorry, no. Like I'm telling, because the pattern now, the methodology and the level of questions that they are asking in the OPRA
Yeah, understood.
okay? So they have increased that level. Okay, they have increased that level, and that also they changed the methodology and the pattern. So that's why if they have already cleared this OPRA exam, so it means that it becomes much easier to clear this intern written examination.
So the readiness is increasing. The readiness for
Exactly.
preparing
So
yourself for Australia is
preparing,
increasing.
yeah, is increasing. So that's what APC is aiming for. So Australian Pharmacy Council is aiming for. So APC, they have clearly mentioned that we need to get some overseas candidates who are ready to practice in Australia. Okay. So rather than just assessing their knowledge and putting them in the internship, okay, so they want to get some candidate who is ready to practice in Australia by clearing anyhow by again they must do the internship and also they need to clear this two exams, that is the written and the oral exam.
One student is asking how many months would be this OPRA. She basically means the duration of the course that Elite Expertise is going to start.
So for the first batch, like we are going to give you a long-term training. Okay, so because everything the students they need to learn from the basic concepts and so on. Okay, so we are going to give you a long-term training for the OPRA exam for the first batch. Like we are going to start it from 10th of next month in the sense which is starting from tomorrow. From 10th of August, we are going to start and it will run till March until they sit for the exam.
Okay. Yeah, one of the student is asking whether if they pass the paper 1 and fail in the paper 2, under CAPS, will the candidate be able to give the CAPS exam in March 2025?
Exactly. So they are still eligible. They can still resit for the CAPS examination. Okay. So APC has clearly mentioned that there will be two pathways for them. Okay. So in case if the candidate has failed the CAPS, one of the papers in the CAPS, and if they want to reappear for the same CAPS examination, or if they want to resit for the same CAPS examination, so they can go ahead with the CAPS exam. Or they will also have the another option if they want to go with the OPRA exam, so they can select the OPRA pathway. So both the options will be open for them. But for all the new candidates, no more CAPS. So they must sit only for the OPRA exam. Only for old candidates in the sense, the last exam is November 2024. If the candidates, they won't clear the CAPS in November 2024, if they are unsuccessful in the November 2024 CAPS examination, so they will have the eligibility to resit for the same CAPS examination.
Okay, yeah, that was insightful, and that's all from my side. Ashita, if you want to take over.
I'm getting questions more of the course which is offered by Elite Expertise. I don't know why, sir.
Yeah, you can just ask.
That is the trust that we gained from our CAPS results and from
Yeah, they're asking like whether Arif sir and Harika ma'am will only be teaching, how much time in a day it will happen.
We both will be the main teachers. So we both will be the only teachers for the CAPS. Okay. So we will be teaching for the CAPS and also for the OPRA exam. And as I have mentioned that as we are taking the classes regularly for the CAPS students. So at the moment we are taking 3 days per week, but from next month it will increase to 4 days per week. Then after that it will increase to 5 days and 7 days per week. Starting from morning, the candidates, they need to soon after wake up, they need to have their breakfast.
Join the class.
Yeah, they need to join the class. So that's how we did for Neha as well as Rakesh, and really. So you guys were there for when you were preparing. Okay. So and all the candidates, those who have cleared the CAPS examination for the last 1 month. Okay. So we will never leave them.
Yeah.
We'll give only like 30-minute short breaks. You must go and have your lunch. You must go and have some tea break. You must go and have some fresh up, and then must join in 30 minutes. Okay? So they will be completely engaged with us from morning till night until they go to bed. Okay. So it means that we will be doing a lot of revisions. Okay. So
we have got this question for the CAPS you would be giving live and the live recorded classes. So for the fresh batch also you are giving live classes. For OPRA it's the same. You're not at all giving any recorded. Every class is a live class. If a student misses, it will be live recorded. Isn't it the same?
Exactly the same thing. So even for OPRA we will give the same type of the lectures. So at first we'll give the live lecture, and that live lecture will get recorded. Okay. And then the candidates, they can watch that recorded lecture later on.
Understandable. Yeah, so maybe in the next, maybe on the OPRA course launch day, we'll be meeting the audience more, I believe. They can ask their questions more on that day. Stay tuned to Elite Expertise YouTube channel, guys. You'll be having many insights, not only on OPRA, but also PEBC. Additionally, CAPS. Soon we'll be giving you, if pharmacists want to have an aspiration to go and work as a registered pharmacist, you name it, in US, Canada, the other countries, Elite Expertise is giving you that amount of knowledge, where I strongly believe no other institute or no other channel will be giving you the great insight with an elaborative lecture. I can say it lecture because Arif sir is a lecturer for the students, like a trainer and everything. So yes, sir, I guess that's all from my side. You want to give a thank you note? Sahana, you have anything? Sahana, Neha, really, Rakesh? No? Yes, sir.
Nothing from my side.
Thanks. Over to you, Arif, sir. Just 2 minutes for the audience, whatever you want to say. Then we can close the session.
So at first, I would like to thank everyone, those who are watching this live session. So for knowing more about this new exam pattern that APC is going to implement from March 2025. So I hope we have answered most of your queries. Okay? But still, if you have any questions, don't hesitate. So you can just send a message to us. Okay? And also, please don't forget those who are watching this session, the live session. So please don't forget to subscribe our YouTube channel. So we'll be keep on bringing a lot of new updates regarding the exams and the changes and what's going on throughout in the Australian pharmacy practice and Canadian pharmacy practice. Okay. And also soon we are going to launch the NAPLEX and examinations. Okay. So please stay tuned with us. Okay, so because we are those who help the candidates and those who already help the candidates. So far around 1,000+ candidates have cleared the KAPS examination under my guidance. Okay, and they have become a registered pharmacist. Okay, so they are practicing here in Australia. So I can say that we are at Elite Expertise, always we try to provide a outstanding knowledge, okay, to our students. Okay, so that's why that result that you can see. So the evidence is nothing but the outcome is nothing but the results. Okay, so we are providing whatever with the knowledge that we have gained in everyday practice, in day-to-day practice. So we will share all those knowledge with the candidates. So that helps the candidates to prepare for any sort of examination at any level of examination. So not only for KAPS, even for PBC, okay, which is the toughest exam, and now the OPRA, which is another new challenge. So no one expects how it will be. Okay, so now by looking at the scale scoring system and so on. Okay, so maybe OPRA will become the toughest exam in the world compared to the PVC. So yeah, so what will be the exam it is? So what will be the thing that you are preparing for? Okay, so we are here to help you. Okay, and all the thing that what will be the trainings that we are providing is at a reasonable price. So you can compare the prices with that of the other institutes that they are charging. So even with the PBC, you can compare, even with the KAPS that you guys can compare. Okay, so we are charging only at a reasonable price and with a 95% success rate, 96% success rate. Okay, so and the final thing that I can say that even for OPRA examinations, so candidates, they need not to worry at all. Okay, so like we will take the complete responsibility. So we'll help you in clearing this new exam pattern. Okay. So that's it from my side. Thank you so much, and stay tuned with Elite Expertise YouTube channel.
Thank you very much, Arif sir. The cherry on the cake on Elite Expertise is like Arif sir, who is working as a clinical pharmacist, who has more than 10 years of experience, is sharing his real-time experience with the students. If a sir gives a lecture, the student will say that he need not, see the lecture again. He'll just give a brief read. So these kind of words the students, and if Harika ma'am gives a lecture, it will just like a small baby, if he comes and asks his mother to give a small story, it will be like that. So I guess having a knowledge from the real-time people, real-time practice, it's most important for any candidate. Like if we take Neha, really, and everyone, the amount of knowledge they get, it's from you guys, it's like irreplaceable and it's commendable, Arif sir. Thank you each one of you, the audience who's been participating. We have more than 100 people live now watching us as well, sir. It has been 1 hour, but we have more number. So stay tuned to Elite Expertise. We are coming up with those webinars regularly, and Arif sir is doing a pharma podcast on August 19th. So you can watch that officially on an Australian channel as well. So he's the first Indian, he's the first clinical pharmacist Indian who is representing. So I'm very happy for that, whatever you're doing, Arif sir.
Thank you so much. Thanks, Ashita.
Yes. So stay tuned, guys, for other further updates. You can always contact us on our LinkedIn. Please follow Arif sir and Harika ma'am LinkedIn. The major updates will be shared to you on LinkedIn, YouTube, a website, WhatsApp, Facebook, you name it, we are all there. So stay tuned, guys, and may all your wishes come true. God bless us all. Bye-bye. Take care.
Thank you,
Thank you,
guys.
madam.
Thank you.
Thank you.
Bye.
Thank you, sir.
Bye.